All right, thank you so much. Welcome to another episode of the Love, Hope, Lyme podcast. My name is Fred Diamond. I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. And we're nearing the third anniversary of that book's publication. You can find it up on Amazon. By the way, I've given out the PDF of that book for free, Dr. Embers and Kevin, to close to 5,000 people. It's available for free, the PDF version. Just reach out to me on social media, Facebook or LinkedIn or Instagram, and I'll be happy to get that to you. If you want to get multiple copies for your family and friends, I've done that, I don't know, maybe 24 times. Reach out to me again on social media and we'll be happy to make those arrangements as well. I'll remind people, if you're listening to the show on Apple Podcasts, thank you so much. Give me a 5-star review. We would greatly appreciate it. And if you're watching this on YouTube, give us a thumbs up. We would greatly appreciate that as well. And feel free to leave comments. You know, Kevin and Dr. Embers, the average show is getting about a dozen comments. And my guests go back and check to see what people have to say. So, I invite you both to do that as well. So today we have a really important show. I'm excited for this. We have Kevin Williams with, how do you pronounce it? Is it Ravel?
Ravel. So kind of
Ra-
like the opposite of unravel. Yep, you got it.
Ravel Health. And we have Dr. Monica Embers, and you're with Tulane, correct?
Yes.
So many people who have watched The Quiet Epidemic might have seen you. So we're going to be talking about some of the medical needs that Lyme survivors had and why Ravel was created specifically to address those. So why don't you both give us an introduction? Dr. Embers, give us a brief introduction about who you are and why we invited you to be on the show. And then Kevin, I'll ask you for an intro, and then we'll get into some great questions.
Thank you. So I am an associate professor at Tulane University down in New Orleans, Louisiana, and I've been studying Lyme disease for over 20 years,
Hmm.
approximately 22 years since I've been here. And what we do primarily is focus on animal models of the disease and the infection. And we work on everything from diagnostics to therapeutics and even vaccines for
Well, you're
Lyme.
doing amazing work, and I'm glad that we finally had a chance to get you on the Love Hope Lyme podcast. And we'll talk about the Quiet Epidemic later. But again, if you haven't watched the Quiet Epidemic, please go find it. I've watched it about a half a dozen times. I've done book signings at showings of the Quiet Epidemic. As a matter of fact, I saw you on Capitol Hill in November. We're doing today's interview in late April of 2025, but there was a big showing that Senator Blumenthal sponsored with the team at the Quiet Epidemic, Lindsay Keys, and had a great opportunity to meet you there. Kevin, why don't you introduce yourself and then tell us why Ravel was created, and then give us an overview on some of your services.
Sure. So my name is Kevin Williams, one of the co-founders of Ravel Health, along with Jamie and Tilly. I'm a chronic Lyme patient of going on 18 years now. And that directly leads into the genesis story of the creation of Ravel. So I will try to give you the quick hit version. So for me, my symptoms started in 2007. Weird constellation of symptoms started with pain and cramping in the palms of my hand and soles of my feet. And from there, over the next couple of years, progressed into migratory muscle pains, which I didn't realize was a telltale sign of Lyme at the time. And this is a time too when I was sort of in my prime, in great shape, was playing a ton of sports, hiking, skiing, had just completed a half marathon when all this started. And from there, the symptoms progressed. So started getting a lot of weird GI issues. Had a knot below my sternum. Had difficulty, taking a full breath. Had no second wind playing sports anymore. And then from there, moved to neurological symptoms. So a lot of brain fog, dizziness, memory issues, eye issues. Um, yeah, just kind of the whole mixed bag that Lyme patients are very familiar with. So that took me to probably 2012 or so. At its worst, had difficulty walking, thought I had MS, and then symptoms just plateaued around then. So, during the course of those years, I saw probably a couple dozen providers, which I know most patients can relate to. My PCP had absolutely no idea what was going on, nor did most of the specialists I was seeing. That went on for the next couple of years. I actually put my name on a wait list of a prominent functional medicine doctor here in Colorado, probably 2015. Thinking that so at the time the wait list was actually roughly 2 years. So thinking at the time I probably wouldn't need it, but I throw my name on there just in case. 2.5 years later, still searching for answers. Met with that provider and finally got a diagnosis in 2017. Um, Once I had the diagnosis, I thought I was, good to go, but that's only half the battle. Spent the next 3 to 4 years, a lot of one step forward, three steps back, trying a number of different protocols with varying degrees of success. And in 2021, met Jamie, who ended up being the co-founder of Ravel. And we had similar overlapping stories, frustrations, and dual reason for creating Ravel. So, number one, obviously, we want to help other patients who are going through this and try to simplify and streamline things for them as much as possible. And then another reason for me, more selfishly, was I wanted, those 15 years where, just the daily impact, how much it had an effect on my life. I wanted that to count for something. So that's how Ravel was born.
Good. So tell us a little bit about some of the services. What do you provide?
Sure. So we provide affordable virtual care to Lyme, long COVID, and complex chronic illness patients. Um, we are, as of last month, live in 46 states. So we're really excited about that. And we just brought on Dr. Bill Rawls as our new chief medical officer. As far as services go, maybe I can talk just really quickly about the process, and that will, uh, you know, discuss some of the services at the same time. So basically, patients, would come to our website, which is Ravel.health. We have a get started button. And we ask patients to fill out a short questionnaire. It's about 10 questions. Based on their answers, we match them with up to 3 Lyme literate providers. And that's, their answers combined with the expertise of our providers. So we'll make that match based on that and the state in which they reside. The patients can review profiles and bios for each of those providers, select the best fit for them. Once they make that match, we have them work with those providers on diagnostics and treatment protocols, just based on wherever they're at in their current personal health journey.
So we get a lot of people who are brand new to Lyme. They just discovered, similar to you, they've had, symptoms, et cetera. And then one day, fortunately, they were properly diagnosed with Lyme. We also have a lot of people who listen to the Lyme Love Hope Lyme podcast who are family members or friends, partners, et cetera. And it may not be clear why a service like Ravel is necessary. So what are some of the challenges that Lyme survivors go through that would make something like Ravel Health necessary for them?
Sure. Yeah, I mean, I think there are quite a few issues with this patient population that don't necessarily exist in the same way as other patient populations. So, the big one out of the gate when patients are having all these symptoms, multisystemic, they don't know what's happening, as where do they turn? So most providers just don't have the experience or the training. Um, and in the worst cases, those providers, medically gaslight these patients and make them think, their symptoms aren't real, it's all in their head. Is the last thing these patients need. So, one of the big things we want to do was to curate and vet providers and to take care of that for patients. The last thing patients when they're sick want to have to deal with is sifting through all this information to try to find someone who actually has the experience to work with them. So that's a huge issue. Another big one, especially for the more well-known providers, is that they often have wait lists that are months to years long. As I mentioned for me, I was on a wait list for 2.5 years. When you're going through this and you're in the throes of it, you don't want to have to wait that long to to find someone to work with you and help you. So we don't have any wait lists. If patients come to us, we will match them with providers It's not quite on demand, but it's more or less immediately. We'll make that match within 48 hours typically, and patients can start with them either the same month or next month. The next big piece, obviously, is cost and affordability.
Mm.
Um, Many patients, myself included, have spent tens of thousands of dollars trying to figure out what's going on, and to try to get better. So, as patients ourselves, it's really important to us to make this as affordable as possible. So, compared to market rates, I think most patients will find that we're very reasonable comparatively. And then another big issue too, I think, is just access as a whole. A lot of people, especially if they don't live in big cities, if they're in rural areas, um, it's difficult, especially, if you're not feeling well, to get to appointments. So all of our appointments are virtual. We try to do everything from the comfort of home. Pretty much all test kits, supplements, all that is, sent to a patient's door. So we're really trying to, in our early days, streamline and simplify just all the pain points that are there for patients. And then there are a lot of other things we want to do, grand vision, down the road.
Yeah, Dr. Embers, can you imagine if you had a heart attack and you had to wait 2.5 years to get an appointment, or you broke a bone and you had to wait 2.5 years to get your ankle fixed? It's just insane what Lyme patients have gone through, and I applaud Kevin and Jamie for creating Ravel. And so, also, I want to acknowledge you. So you're now involved with Ravel. So give us a perspective on why you made the decision to get involved with them.
Yeah, so I really don't know how I got initially contacted. I think it was through LinkedIn, and there was a New Orleans or a Tulane connection. Um, and I am not a clinician, as you know. I'm a scientist and a researcher. And I can tell you that every single week, almost every day, I hear from patients, and um, I hear from them, and they want to know, what's the latest on treatments? What would you recommend? And are there any doctors in Louisiana? It's very hard for me to respond to patients who reach out, because there is no central um, place for them to turn, where they can get access to to medical care or specialists for Lyme disease. And it's also very important that the physicians that are recommended are vetted. So I don't feel comfortable recommending a physician that I don't know, or I don't know anything about. And so through Ravel Health, they go through that process of interrogating the providers. And I'm not directly involved in that process, but I think where I can help and where they hope that I can consult through their scientific advisory board is in bringing the latest research to the clinicians and to the patients, and saying, maybe, it would be safe to try this, even though we lack clinical trials for a lot of things.
So I want to get back to you in a second, but Kevin, I just want to ask you a clarifying question. You said you're in 46 states. So, but you also said that almost everything is over telehealth. It's over the internet, if you will. So what does that mean? That patients from 46 states can now use Ravel's health services, or you have doctors in 46 states? Could you explain why that's such a big point?
Correct. Yeah. So the regulatory framework in the U.S., as you might imagine, is quite challenging to navigate. So when we say we're live in 46 states, that means that we're able to legally provide services in those 46 states. It looks a little bit different in each of those states, dependent on that state's particular laws, how things are set up, the particular designation of a provider that someone is working with. So, we try to include that language because it's so different. It's hard to like really encapsulate that, in just a paragraph. But we let patients know, if they have any questions at all on, what the scope of practice would look like in their state, just to let us know, and we'll, kind of talk through the nuances of that.
Very good. Back to Dr. Ember. So again, I mentioned before you were featured in the Quiet Epidemic, which once again, if people haven't watched it, please do. It's available in many, many places. It's a fascinating documentary on just the history of Lyme disease over the last 50 years and very clearly spells out the fact that Lyme disease can happen anywhere in the country, right? You know, some of the opening scenes are ticks on birds flying all over the place. And as people who've listened to the Love Hope Lyme podcast know, I've interviewed doctors in Europe. I've spoken to thousands of people all across the globe who are struggling with this disease. Tell us about yourself. Why have you devoted a large part of your career to researching Lyme disease?
Back to that documentary. It's a very well-made documentary, and it's very informative. Um, I attended graduate school in Pennsylvania, so I was at Penn State for my doctorate, and I wasn't studying Lyme disease, but I became very aware of Lyme disease at that time, and I was also fascinated by how pathogens, bacteria and viruses, particularly, can evade host immune responses and persists in hosts. And so um, this it was very interesting. I found this article that I wanted to present at Journal Club as a graduate student, and it was on Borrelia burgdorferi, and it was published from the lab where I currently sit at Tulane. And so after I read that article and started researching, I knew that that's what I wanted to do after I left my doctoral program. And one thing led to another. I emailed the PI, the principal investigator here at Tulane, and he found a way to bring me here, and I've been here ever since.
Well, that's incredible. For people who've listened to the show, I'm from Philadelphia originally, and my older daughter went to Penn State. So we are. She didn't go for her PhD degree, but for her PhD, but she definitely went undergrad, actually in biomedical health. So we're doing today's interview in April of 2025. And we've also had on the Love Hope Lyme podcast some of the leaders from the Center for Lyme Action. And of course, their mission is to lobby Capitol Hill to get federal funding for Lyme disease research. And again, we're doing today's interview at the end of April of 2025. Dr. Embers, of course, there's been major challenges with federally funded Lyme research, and it's a mess. It's a big problem. Give us some of your insights. What can you tell us about how funding going away will affect Lyme survivors?
This is a difficult topic, and it's one that I've faced for my whole career. So I sit at a primate center. I work with non-human primates, and we have a history of HIV research because non-human primates are the only legitimate model for AIDS, or the best model for AIDS. And so this is where the non-human primate model for Lyme disease was developed. And originally, there were some studies that were funded that were very beneficial in the non-human primate. But I think there has been historically there's a shift in Lyme disease in particular and other bacterial infections to focus on pathogenesis, to focus on molecular studies of the bacteria itself, and not as much on translation. And then the politics of Lyme disease has played into that as well, because the prevailing opinion among doctors, as a result of the recommendations of the IDSA and so forth, is that it's easy to diagnose and simple to cure, and that's not accurate. And so we have been focused for a long time on diagnosis and treatment. And I think, right now we're on the verge of a commercial test for Lyme disease that is significantly better than what we have. And that's the first piece of the puzzle that needs to happen, because doctors need to know when a patient comes in that they do or do not have Lyme disease. And so this, I belong to a company called ACEs Diagnostics. We have a test called LymeSeq that's going to be coming out hopefully next year, that has over 90% accuracy, whereas the current testing is 40 years old. It's terrible. Patients are falling through the cracks. So that's the first part. And then the treatment. And so the thought has been that you treat with doxycycline or amoxicillin, and if patients don't recover, it's because of something other than a continuous infection. We've shown in non-human primates, we've shown in human autopsy specimens that there can be a continual infection after antibiotic treatment. So we're working hard to develop those treatments. And I will say, from the federal government perspective, they have invested in diagnostics and they have invested in vaccines, but they have not invested in therapeutics. So we've gotten the majority of our funding for therapeutics from foundations like the Stephen and Alexandra Cohen Foundation, Bay Area Lyme Foundation, and Global Lyme Alliance. They've all contributed to this. And now we're also working on Bartonella, which is something that affects a lot of Lyme patients. And so do I think that the changes in government that have happened recently are going to have a tremendous impact on Lyme patients? Not really. I mean, I commend everyone who's working hard on getting more government funding. We're now seeing Department of Defense funding, which has been really great. It's not a whole lot, but it's something. And so I think I want to encourage all the advocates and all the scientists to keep pushing the NIH for more funding. Because every part of it's important. Even those molecular pathogenesis studies are what helped us get to the diagnostic test, get to the, better therapeutics and vaccines. And so I think even if we're flatlined, in terms of the translational research, the foundations, and there's some industry interest now. So pharmaceutical companies are interested because it's becoming more and more prevalent. And yes, there's money to be made off of it too. So hopefully pharmaceutical companies will be more interested in helping develop diagnostics, therapeutics, and vaccines for Lyme disease.
So thank you. So Kevin, based on what Dr. Embers just said and what you said before, this is, as we're talking here, Dr. Embers talked about diagnostics and then treatment. And, even you said you went a number of years with symptoms. And then luckily for you, one day a doctor said, I think you have Lyme disease. And a lot of people think, yes, I've been diagnosed properly, but then comes all the challenges with the various ways to treat. And that's not just you. I've spoken to thousands of Lyme survivors, as I'm sure Dr. Embers has as well, who are in that, conundrum of, what do I have? And then how do I solve it? And then, oh, there's no real great solution. There's no way to test it really well. And there's really no way to solve it really well. Where are Lyme patients on their healing journey when they come to Ravel?
Yeah. Let me just really quickly say, based on what Dr. Embers was just saying, why we're so honored to have her on our, scientific advisory team, because, she is working on the cutting edge of science, and to be able to bring that directly to our providers, with these diagnostics and new therapeutics, and not have to necessarily wait, for years and years for it to go through sort of, like peer review and then make its way into sort of the mainstream. We're really, really excited about that. To answer your question, I would say, the patients that we're seeing are pretty typical, I think, of most Lyme clinics in that, we've got maybe a handful of acute cases, but we're seeing patients who've been sick for years, oftentimes decades. And, these patients have been put through the ringer. And we, we don't say we have a magic bullet or anything. We're really just trying to, at this point, simplify things for patients as much as possible, let them know that we're there for them, we have their back, and we'll, work with them to, you know, to the best of the collective, knowledge that is there at this time, on a customized and personalized basis, work with them, to pinpoint how we can help them essentially.
Yeah, you just used the word personalized. So, most Lyme treatment is personalized. The person's genetic makeup, how long they've had Lyme, their, ability to handle heavy metals, et cetera, if you will. Dr. Embers also mentioned Bartonella and Babesia, the common co-infections that we've spoken about many times. There's no set protocol for every patient with all the co-infections as well. How does Ravel handle that?
Mhm. Yeah, so the co-infections, and then on top of that too, you have mold toxin illness and mast cell, and we use Lyme as a bucket term for all of that. There's so much overlap with all these conditions. So again, when a patient comes to us and they start the process, they're matched with a provider. It's not one set protocol or anything like that. And that's why we do the matching, and we spend a lot of time there to really try to make sure that we're pairing patients who have specific needs with providers who have experience in those areas and those areas of expertise. So maybe if there's something that they haven't tried, our providers can uncover that. Um, so it's similar to a patient going into doing all the research themselves, going to a normal clinic, hoping it's a good fit. We try to take all that heavy lifting off of their plate and make a good match for them. And then it's based on their history. We do an initial 2-hour patient visit. And the provider will, sit with them, go through their history, figure out maybe if something's been missed on the diagnostic side. Again, if they have any new ideas on treatment, um, a lot of things there, I think, could dive into, but I know we're sort of limited time today, but yeah, and then the providers will work with the patients. And then just a note too, because I didn't mention this earlier, we're actually subscription based. So both Jamie and I are big proponents of continuity of care. We've both been in positions before, even when we're a patient of a provider, where we've had really bad flares and we haven't been able to get in to see someone. So, after that initial 2-hour appointment, patients can select from 30-minute, 60-minute, or 90-minute follow-up appointments on a monthly basis, and they can upgrade or downgrade based on wherever they are in their, in their personal health journey.
Before I get back to Dr. Embers, I just want to ask you one other question that's kind of come up here. It seems that on almost every Love, Hope, Lyme episode, we talked about mental health as well. I'm just kind of curious, is counseling or psychological treatment, is that offered today or something in your future or something that's totally separate from what Ravel does?
Definitely not totally separate. We do have a few providers in a few select states as far as mental health therapists go, Lyme literate mental health therapists. But we are looking to incorporate that nationally. So, and not only mental health therapists, but also Lyme literate functional nutritionists. So that is definitely in the vision. We don't have a set time frame for it, but it's something we're looking at doing for sure.
Very good. Dr. Embers, where are we with Lyme treatment and research and practice? And how does this play from what you see with where Ravel is and what they're doing?
Yeah, just another point with respect to why you can't wait 2.5 years to get diagnosed and treated is because, because of the mental health aspects as well. And patients are much more likely to consider suicide as a Lyme, sufferer. And we've had those suicide cases in our lab from the autopsy specimens, and it's awful. So where are we? Well, I think, we've done enough work to indicate that you can definitely have persistence after infection. There are some new studies showing that you can have lingering antigens that can cause inflammation. And so now, we really need to shift more towards, what we're talking about, personalized medicine. And I like to think of Borrelia kind of at the core of, because we know it can suppress the immune response. And so if there are other co-infections, they can be a lot worse if you have Borrelia. So really eradicating the pathogen, I think, is very important. And so what we found is that no single antibiotic is working effectively. You need to treat with combination antibiotics. We need to use multiple antibiotic or antibody responses to determine if a patient has Lyme disease. So, the C6 test is great when it was developed, but a single antigen ELISA is not going to tell you if you have Lyme disease or not. So we've done a lot of incorporating machine learning into determining, what's effective. There's some really great research out of MIT looking at biomarkers for Lyme disease, looking at women's health with Lyme disease. And so I think incorporating all of that into finding the best treatment option for patients. And I don't dismiss, the wellness part of it too, right? So, Kevin talked about functional medicine physicians. So, what you eat and how you treat your body is really important in getting better as well. So, and you can't do that if you're depressed. Like you can't do that if you're so sick you can't move. So it's all important. And I think just research is really important, that we continue to study all these aspects and use the latest technology to figure out how to best treat patients.
Yeah, that's great. I remember I interviewed a Lyme literate doctor for the Love Home Lyme podcast, and he said if he could make one recommendation, the top recommendation would be get plenty of sleep. Ensure that your sleep process and habits are sound. And he said that's if I only had one recommendation for any patient he's ever treated. Well, once again, I want to thank Dr. Monica Embers, and I want to thank Kevin Williams from Ravel Health for being on the show. And a lot of the stuff that we talked about it's just amazing that people have to deal with this. So Kevin, I acknowledge you and your partner, Jamie, for coming up with the idea of Ravel Health and for all the good that I look forward to you providing to chronic Lyme survivors, as they come upon your services. Why don't you both give us a final thought, something that you want to leave the show with? Dr. Embers, why don't you go first? Just whatever it is you want to get across to chronic Lyme survivors or their family members who may have listened to today's show.
I've been doing this, like I said, for 22 years, and I'm more optimistic today than I've ever been. I think we're on the cusp of multiple better diagnostic tests. We're learning how to better treat patients. And I hope that we can leave patients with some optimism that there is help coming.
Very good. Kevin, why don't you wrap us up here? Bring us home.
Yeah, I mean, so I think because Jamie and I are patients ourselves, so we try to create a very patient-driven platform and option. I think as Dr. Embers mentioned, I'm really excited at this point just with the possibilities and opportunities. For us, we're still early in our evolution, but Dr. Embers mentioned AI. Really working. There's so many providers out there, I think, who feel like they're on an island. So we're excited to provide community for those providers and, to bring the science directly in. And because I think a lot of times, patients will go to see someone and they've sort of been doing the same thing for however long. And not to say that they're not, continually learning, but I think Jamie and I can instigate that in a good way and make sure that we're kind of bringing the latest and greatest in. So really excited, just to sort of echo what Dr. Ember said, really excited for what's to come.
All right, very good. Once again, I want to remind people, if you're listening to this on Apple Podcasts, please give us a 5-star review. We would greatly appreciate it. The PDF to Love Hope Lyme with family members, partners, and friends who love a chronic Lyme survivor is always free. Just reach out to me on social media, and the book is available on Amazon. And again, if you're watching this on YouTube, please give us a thumbs up. Leave a comment. We would greatly appreciate it. Once again, thank you so much, Dr. Embers, and to Kevin. My name is Fred Diamond. This is the Love Hope Lyme Podcast.